Hello, everybody. I'm Donna Anderson, and I'm author of lovefraud.com. And today we're with Dr. George Simon. Now, Dr. Simon is the author of several important books, one of which is called In Sheep's Clothing: Understanding and Dealing with Manipulative People. He also wrote Character Disturbance, and his most recent book is called How Did We End Up Here? And it's for people who are in relationships with disordered personalities. And Dr. Simon is going to be presenting a program for us on Love Fraud Continuing Education, and that's what we're going to be talking about today. It's called Character Disorders and Disturbances, and it's for therapists who treat character disordered people in their practices. So, welcome, Dr. Simon. I'm so glad to be with you today.
Thank you, Don. I'm glad to be with you.
Okay, so you say that typical insight oriented therapy doesn't work with people who have character disorders. Now, why is that?
Well, the traditional insight-oriented therapy was never designed for dealing with character disturbance. It was designed to help individuals who were struggling with fears and insecurities, shame, guilt, and so on, that they deeply repressed and therefore were unconscious about, and it was still causing them anxiety and anxiety-related symptoms. And insight-oriented therapies were designed to help these folks come to greater awareness. This is the very definition of neurosis. Character disturbance is very different from neurosis. And it's different from neurosis on multiple dimensions. And the more serious the character disturbance, the more serious the differences are between the problems that neurotic individuals have and need intervention with. So um, uh, it's not so much that you can't treat character disturbance. It's difficult to treat, but you certainly can't treat it with methods that were never designed for the problem. And I talk about these differences. I talk about all the dimensions of these differences in my workshops. I explain how the approaches that do work best fit all the different characteristics of character disturbance. And that's what I talk about also in my books, my four books, and that's what we specialize in the workshops.
Okay, so what are some of the erroneous thinking patterns that disturbed individuals display?
Well, let's take a few of them. You can't catalog all the twisted ways of thinking
Hmm.
that disturbed characters think, but there are several more common ones, and let's take a couple like egocentric and egomaniacal thinking. They commonly go together. Thinking so much about yourself, focusing so much about on yourself and what you want that you don't have any mental space or room for the needs of or the concerns of anybody else. Egomaniacal thinking, thinking you're so special, so important that you ought to be able to do whatever you please and get away with it. These two things, when they go together, can lead to a really massive sense of entitlement and where the person basically feels entitled to do whatever they want to do in a relationship without consequence, without really thinking about the other person, behaving in such a callous or indifferent way. You know, we know that the way people think affects how they behave. And so if you're thinking in those entitled, callous manners, you're going to behave in those ways in a relationship. Another example would be possessive thinking.
Hmm.
Thinking of all the things that you crave in your life, whether it's a material object or even a person, thinking about those things as property or possessions, yours to do with as you please because you own them. It's a more of an attitude of ownership, and it's a very common kind of thinking, especially in abusive relationships. And this is where what leads a person to perceive the person as to perceive the relationship partner as primarily an object to be used and not a person to be respected.
Right. Okay. So, Dr. Simon, how will this course help therapists?
Well, I'm going to give therapists an approach, a demonstrated approach, and some methods that are really more tailor-made for the problem of character disturbance. And I'm going to acquaint them with the tools that will really empower them in their work. You know, we know from the cognitive behavioral theory that how we perceive things really influences how we act. And that's true for therapists too. How we perceive a situation, the ways in which we think about things, the way we conceptualize a relationship or the things and the dynamics going on in that relationship influences how we tend to want to intervene. And what we know about character disturbances is a different phenomenon and it requires a different approach. And so I'm going to be acquainting folks with that approach. I'm going to be giving them practical ways to see things and do things differently in their therapeutic encounters that will not only treat this very, very difficult problem, but help them actually affect change. We know that this is a difficult problem. It's not as impossible as it seems, especially once you have the right approach. And it's so important for therapists to get the framework right because when we don't, we not only fail to intervene effectively, but we also sometimes inadvertently and unintentionally uh, re traumatize the victims or the troubled relationship partners of disturbed characters who have come to us for help.
Well, Dr. Simon, I'm so glad that you're doing this presentation for us. I know you have a wealth of fabulous information, and it's really going to be helpful for the people who participate. So thank you so much.
Thank you, Don. I'm very happy to participate.